Exercise is an important part of any healthy lifestyle. It strengthens the heart and makes it pump more efficiently, so it is particularly critical if you have hypertension. To improve cardiovascular health and maintain your weight, try to get 150 minutes each week of aerobic activity. You want to spread this over at least 3 days, with no more than 2 consecutive days without exercise. This can include walking, cycling and swimming. If you find yourself struggling to figure out which foods in the grocery aisles have too much sodium, here's a good tip to follow. Food in its natural state is best. Skip over processed foods and opt for fresh fruits and vegetables, whole grains and lean meats. If you are planning to start a low-sodium diet, no more than 1,500 milligrams per day, the first step is to get rid of the salt shaker. In its place, use salt-free herbs, spices and other seasonings. It's also important to watch for hidden sodium in the foods you eat. The following items are typically high in sodium, so try to avoid them. Processed foods, such as hot dogs, packaged lunch meats and salami. Canned foods. Prepared or frozen dinners, even ones labeled lean or healthy, may still be high in sodium. When eating vegetables that aren't fresh, opt for frozen over canned. Foods labeled low or reduced sodium are usually good options. If you have diabetes and high blood pressure, you may be taking medications that help relax blood vessels so they don't constrict. The important thing about these medications is that you must take them regularly. Forgetting just one day can result in a high blood pressure pretty quickly, so be sure to resume any missed doses as soon as possible. If this is an area where you have trouble, it is worth making an effort to fix it. If you have diabetes, it is important to learn how to monitor your alcohol intake. First, talk to your healthcare provider to make sure it is alright for you to consume any alcohol. This is particularly important if you also have hypertension, because consuming large amounts of alcohol often increases blood pressure. The common recommendation for moderate alcohol consumption is 1 drink daily for women and up to 2 drinks daily for men. 1 drink equals 4 ounces of wine, 12 ounces of beer, or 1 ounce of distilled spirits. If you are a smoker, quitting will greatly reduce your heart disease risk. When you smoke, your blood vessels constrict, which can raise blood pressure and also cause the release of hormones that work against insulin. This may raise blood sugar or increase your risk of getting diabetes if you don't already have it. Another important thing about quitting smoking is to be ready to work to keep your weight down after you stop. But take it one step at a time. Your doctor can help you create a plan to keep your weight in check while kicking the smoking habit. As you work to keep your blood pressure in check, remember to talk to your healthcare provider about your target blood pressure goals. There are overall guidelines, but each patient may have different targets suggested by their provider.